but they may not be telling that person, I'm thinking about killing myself, or I'm thinking about hurting myself, I'm depressed. They may be coming with all those other issues. And so it's just really important that, first of all, that stigma be taken away, that people can talk about if they're really depressed or anxious or suicidal, whatever the case may be, but also then that the person on the other side, whether it's sometimes doctors are shocked, they're not always sure how to handle that, or they don't want to hear that. They don't ask the question sometimes, are you okay, are you depressed? Because then they might have to do something. And sometimes that's difficult if there aren't a lot of options for things to do. And then other professionals too. What do I do? How do I ask that question? And then what's the next step? So that's mental health first aid kind of helps people know what are the next steps. How do I connect this person to professional help? What are some self-help strategies I can give people if they're not in immediate crisis, but what are some other things I can do? So it gives you steps to follow in order to help people. So as we said, it came from Australia, and it was created by a mental health nurse and her husband, who is a professor of mental health literacy, so mental health education. And then Betty, the nurse, also suffered from depression and just kind of thought about it one day and thought, why don't we create something that's like first aid but for mental health, to help people learn how to just help others and to reduce the shame and stigma that goes along with mental health problems. So that's kind of how it started, and it spread to many countries around the world. And as I said, the United States, it just came in 2008, and so it's really spreading quickly. A year ago, in August, so August of 2008, we had our first group of 22 instructors trained in Iowa. And then in June of 2009, we trained another 25 instructors. And not all of them are currently active, but we have about, like I said, 45 to 46 instructors in Iowa. And here in your area, Patrick Schmidt at Plains Area Mental Health and one of his co-workers are trained instructors. And then in Humboldt County, Kim Vidsum, who works with Iowa State University Extension, and Lori Hammond, who works for HCBS. I can't say all of her titles, but she works for Iowa State also. They are both also trained instructors. And so we have some resources up in this area of people who are interested in doing trainings. So that's kind of the quick version. I guess one other thing I'm going to talk about is anybody who goes through the 12-hour course with us, talk about the fact that we repeat one thing over and over and over. And that one thing is what's called ALGE, which is the 5 steps of the Mental Health First Aid Action Plan that you use in any situation. And it's A for assess, so assess the situation for self-harm or risk of self-harm or danger to the self or others. Listen non-judgmentally. A lot of the program is about learning how to listen and accept people as they are, and so that they will feel more free to talk about what's going on if you can listen non-judgmentally. So there's a lot of focus on that. Give encouragement. So giving them encouragement that people do recover from depression. People do recover from anxiety. There's treatments, there's medication. So just giving them hope, giving them encouragement that even though things may be tough right now, they have hope. Excuse me. The next E is encouraging professional help. So part of what we do when we teach this class is we make sure that people know what the professional resources are in their area. Do they know their community mental health center? Do they know who to contact there? Do they know about the other resources, the primary care, just whoever it is who might be a resource for that person? So we talk a lot about what the professional resources are, and then also the last E is encouraging self-help strategies. So if that person is suffering from depression, do they know that exercise can be really helpful? Do they know that they need, it's important to be around people, to not isolate? Do they know that they need to get sleep? Just kind of common sense things, but making sure that not only is in support groups. Do they know about support groups? But helping that person kind of feel empowered and that there are things they can do themselves as well as seeking out professional help. So that's a real brief run through of what mental health first aid is. As I said, it's a 12-hour course. It can be taught in 2 6-hour sessions. It can be taught in 4 3-hour sessions or even 6 2-hour sessions. It really just depends on your group and works for you and how you want to break it down. Is that it covers really a lot of good basic information about signs and symptoms of the major mental illnesses, and then also really works on how you respond. What do you do if somebody says they want to kill themselves? What do you do if somebody says that?
So you guys will train anyone or any group of people?
We are really wanting to see the people who have been trained. And yes, in the Department of Human Services, we have 3 within DHS, within MHDS, within Mental Health and Disability Services. We have 3 instructors. There are actually 2 targeted case manager supervisors who went through the training with me in August. And they will have to kind of see where they're at on if they're going to be training or not. I know their schedules are, tight. But that is Terry Kuntz in Mason City is an instructor. So, and then in Netherlands and Southeast Iowa. And then, but we really want to see local resources, training local people, unless there's nobody else that's able to do it. My coworker and I are going to be training in Ottawa next week at Burgess Hospital, and that's just kind of something that was arranged a while back. But we're gonna. So normally they don't want us to travel halfway across the state if there's somebody right there in that area who can do it. And so.
In January, Lori Hammond and the gal from Humboldt, are coming over to public health in Rockwell City, and they're going to train the aides, and they go into the homes for the Family Foundation's clients. So.
Yeah, and I know they're really interested in doing.
Do you know when?
We've got some tentative dates. We're trying to firm up Kim's schedule. I think I've got it in my plan. Okay, but
I was going to say.
if somebody's interested in that training, we've got 22 signed up right now.
What is the preferred group size?
I would say not many more than 25. I would say in that neighborhood of 25. Because it's a very interactive class. It's not 12 hours of lecturing at all. It's really a lot of group work. There's some small group work. There's quizzes. There's role plays. There's interaction. There's just it's not. We try to make sure that nobody's sitting for more than 20 minutes, I think, before we do something or talk about something. So it's not something you would want. I don't think I'd want to do 50 people or even 40, 30 at the most. 25 is probably a good group. And also because there's a lot of discussion. People have a lot of questions about this. I had a family member who had this, and what should I do in this situation? And so a lot of, in everyone I've been in, there's usually been somebody that says, I had a family member who had schizophrenia, and this is what it was like, and it was really hard to deal with, and we didn't know what to do, and I wish I would have had this before. And so there's always those really good stories that it's kind of, fit into what we're talking about, but you're not going to have people who is free to share this huge group. So yeah, I'd say 25. And we think the groups I've talked to, I think that one of the groups I met with in Creston that I helped train, they had folks who did in-home work. Not so much with families, but more with adult clients, maybe with mental illness. And so from one week to the next, they were able to take some of the things they learned the first week, use them with clients, and like helping a client go through a panic attack without it turning into a trip to the emergency room. And they were really thrilled that it was, that hey, I took something out and I was able to use it, and it actually helped my client manage their situation better and gave them a tool. It's kind of using a self-help strategy for that person. And so that's kind of neat. So there's some practical things. There's the knowledge, which hopefully people will use in their daily lives with their family, their friends, or in their work situation, but then also just some skills, some actual skill things that they can take out and use right away. Any other questions that you can think of?